My name's Olivia Barney. I'm a consultant gynaecologist in Leicester University Hospitals.
Hi, my name's Nicola Woods. I'm currently the endometriosis nurse specialist and I work across all 3 sites of University Hospitals of Leicester.
My name's Nyree Abbott. I'm a trainee advanced clinical practitioner and I work in gynaecology at the Leicester General Hospital.
Our hospital serves a large population of around 1 million patients, and it's the 3rd largest population of women in England. We carry out about 2 clinics a day with 5 MyoSures in a clinic on 4.5 days a week. So we do about 45 to 50 MyoSures in a week on average. All the patients that we see are offered an ambulatory procedure as the standard preferred choice. The only patients that would be more cautious about doing in an ambulatory setting would be somebody with a fibroid of larger than 5 centimetres. As realistically, these patients are going to do much better with an ultrasound-guided radiofrequency procedure or a myomectomy or a hysterectomy. Women who have complex medical problems are often taken to theatre as they are deemed to be more high risk. But what that means is that they end up taking up a lot of space and time in theatre. They need a lot of space and time in the pre-assessment clinic, formulating bridging plans for anticoagulants, and taking up a large multidisciplinary team's time to organise these patients for theatre, when actually these patients can be done perfectly safely in an outpatient setting. It often takes far longer in theatre than it would to actually do the procedure itself. Many women who have comparable procedures in theatre may often need an overnight stay in hospital, which is eliminated completely with an ambulatory approach. We have very few contraindications to our ambulatory clinic, and we have an oncology team who are extremely appreciative of the benefits that our service is bringing to their patients. We don't get any inadequate samples, for example. I was delighted to be the first clinician in the UK to use the Fluent fluid management system. We quickly saw the benefits of this system. The NICE interventional procedure guideline in August 21 stated that automated fluid management systems should be used with devices to reduce the risk of causing excessive high uterine pressures and subsequent fluid overload. And we found that Fluent is simpler than Aqualex that we were using previously. It requires less training of the healthcare assistants and the nursing staff. Causes a lot less mess, a lot less fuss and faff, with a shorter procedure and a shorter procedure time between the procedures. You get a much better view because it maintains the pressure throughout the procedure within the cavity. You have a much shorter procedure, which is better for the patient, and also we found that we had fewer 2-stage procedures or abandoned procedures due to poor visibility. As a result of the Fluent fluid management system, we were able to increase our clinic productivity from 4 patients to 5 in a clinic.
The outpatient setting is brilliant, and I think it should be pushed and encouraged to develop within reason, and making sure that there are the relevant policies in place, training. But I think we do see greater patient satisfaction. I've worked on a day case ward where we would look after patients after they've had these procedures done in theatre, and seeing the difference in their recovery, how they feel in an outpatient setting is just completely different. It's so much better. And we do generally receive very positive feedback from patients that they would be willing to undergo the procedure again in outpatient.
Training and support that we received as a team came from Hologic. Hologic supported the setup with us throughout. They supported us with acquiring all their equipment that we needed. If we had any issues with the equipment, if we had any questions, then we had a phone number that we could contact. Again, not only did they help set it up, but once we were up and running, they still came into contact with us. They made contact to make sure that we were okay. So yeah, they did support us. Hologic did a lot. Being recognised as a Centre of Excellence by Hologic, personally and professionally, means a great deal. I am from Leicester, I work in Leicester, I work across all 3 hospitals, and it is a fantastic achievement. What the consultants, the nursing staff, Hologic team have helped us to be able to become this Centre of Excellence.
I think really it's just an appreciation of the hard work all of the staff put into the clinics, and I think it just helps highlight how we feel we act as a team and the care that we feel we give to patients, the procedures that we do. So I think to receive this recognition just really reinforces what we already feel about the department. I think go for it, but I think it's all about having the right support, the right training, making sure that all the staff feel competent and confident in what they are doing, and that they use Hologic, the resources that they provide, to ensure all the staff are comfortable. I think as well it would be beneficial for teams to go and visit other centres where these outpatient procedures are already done, to get a feel for how the area's run, what's required, and just so they can get a feel and receive some further training.
I would encourage anyone that is considering to transition to outpatient procedures to go and visit a Centre of Excellence, as you will get a real good feel for a fantastic service that is delivered, and it benefits the patient and it benefits the staff.
My advice to other units who would like to tackle more larger pathologies or more complex patients would be to come and see our unit and see how the service can run to include these more challenging patients and pathologies. We have had tremendous support from the Hologic team from the start, and they continue to support us with training our resident doctors, with simulation workshops, and now as a Centre of Excellence we've got the chance to help our colleagues elsewhere develop their services too.